our objective today is to talk about health disparities for Black communities. Why are there racial disparities and inequities?
Yeah, first, I think it truly warrants taking a moment just to pause and to remember why we're having this conversation in the first place, which is in honor of someone who passed away suddenly. It takes these types of disasters and losses for these type of conversations to begin and to start. I think, Mommy, you've done an incredible job of reflecting on the issue at hand, which is the why, as with any family when they've lost someone suddenly. Why was this person taken from us? Whether you ask that why from a faith background or you ask that why to the system that he or she was in. The why, that question is huge. And you've already started to think about those questions in depth from a more academic perspective, which is beyond what a lot of other families are considering. You've talked about the systemic racism that unfortunately impacts societies around the world, whether it's racism, classism, colorism, these isms that separate people, despite the fact that we, at the end of the day, are really all the same. And they have caused a trickle-down effect and impacted communities in almost disastrous manners. As this pandemic has gone on, there have been more and more conversations as to why. Why is it that Black people are dying 3 to 4 more times than their population numbers of this virus? And it comes down to this intersectionality of inequality.
And the reasons why are systematic and layered, and there's intersectionality, as you mentioned, Rachel. But I also think we can even look at some of the things that are more practical that we know. The people that are most disproportionately being affected are those that have to go to work for their families.
A lot of patients are not in the situation that they're in from their health because of their own volition, but because systemic racism has led to less insurance coverage to minority groups. It's led to communities of color being farther away from really strong healthcare facilities. It's like Joelle mentioned earlier, higher percentage of essential workers that are being put on the front lines, being led by people of color. These are the people that you are thinking, that you should be thinking every day, that racial segregation has shown up in redlining and has really caused poor health outcomes in the first place that make people of color more susceptible to diseases. You as a doctor recognizing that and reconciling that should make you a better provider. You need to listen to them and you need to respect them because they have not been treated fairly, and you cannot extend that unfair treatment by continuing to not address their wellness holistically. It makes me more passionate to be a provider who will commit herself to being equitable at all levels, recognizing that I am also part of a system, that I have a lot of work to do on myself, that I can lead my colleagues to do work for themselves, so that we can make sure that we take care of our patients well.